Hello, class, and welcome to Chapter 14, Case Mix Management. All right, so let's get to the characteristics and population of case mix. Basically, it encompasses age, gender, type of insurance, principal and secondary diagnosis, risk factor, risk factors, treatment received, surgical procedures, medical procedures, and resource used. Okay, so similar that have patients that have similar issues, they will be considered into a case mix that they fall under. Okay, let's say, for instance, I know this is a terrible one, but this would kind of bring uh, some sense to age. Let's say children from the ages of 11 through 16, they're all diagnosed with leukemia. Okay, so therefore this would be their case mix for the children from 11 to 16 that are diagnosed with leukemia, and that would be part of the characteristics of the population for the patients. Okay, so that's basically how the case mix works. It takes the similarities of all the patients and pretty much places them in a case mix because what they feel is since all of those patients are in that case mix, that means the amount of resources such as money, labor time, supplies, so on and so forth, is all going to cost pretty much the same to treat these poor young patients with leukemia. Okay, so that's how they set their patients in a case mix because of the characteristics that they share. Okay, moving along to case mix methodologies. Case mix analyzes, case mix analysts are performed for many reasons. To determine reimbursement, describe a population to be served, and identify differences in practice patterns or coding complexity. Case mix analysis may be performed using one or more variables. Okay, outside of grouping our patients in the case mix, these are the methodologies used to determine basically, okay, so if we have these leukemia children, what would be the determined reimbursement? Okay, so remember, everything is kind of a step ahead of a game when it comes to healthcare because facilities need to know what their monthly revenue is going to be for that month or even for that quarter in order for them to stay in compliant with reimbursements, with OIG, Joint Commission. So it's very, very important that checks and balances are done all the time. Meaning, once you have completed your position, somebody behind you should go ahead and recheck your work just in case everything is correct. Because at the end of the day, whether if you're clinical or non-clinical, the patient is the one that suffers at the end. And it doesn't matter who makes the mistake, whether if it's financial or administrative or if it's clinical. In the long run, we are going to present issues and some chaos to a patient that is ill, and for all we know, it could be the first time this patient's ever felt ill. So we have to keep that in mind about our patients, okay? Data types used in case mix methodologies. Claims data, demographic characteristics, disease and procedure-based classifications, and severity of illness systems. Okay, so these are the methodologies that are taking place. Meaning claims data. Okay, we're going to abstract all of the claims that we treated this patient thus far to see if this patient's been having the same type of problem and we haven't been able to address it. Demographic characteristics, of course, that includes working status, marital status, where do you live, things of that nature. Financial class too as well. Disease and procedure-based classifications, so of course That's going to tell us what type of problems the patient is currently having and the severity of the illness. Okay. Here's the severity of the illness. Here are the options that we can do. Please take your time and please let us know what you decide going further with the patient. Okay. Because remember, all of this, when it comes to the methodologies and the case mix, there's different prices, of course, with everything. There's money linked to everything, no matter what. Even if you don't think money can be linked to it, there is some type of money linked to any of this. Claims data, there's money linked to it. Demographic characteristics is linked to money, because if your patient population is below standard poverty, that's a demographic characteristic, and that's linked to money. Okay? Same thing with severity of illness systems. If a patient is near, I hate to say this, but if they're nearing the end of their life cycle, way to put it professionally, I would say, it costs a lot of money to continue to keep patients alive when it's more evident that the patient will be passing soon. So all of this is taken into consideration, of course, and it's all attached to money. The good old green dollar. Well, it's still green from last time I saw it. Okay. Using claims data. So this is the information collected that they use for claims data. Information limited to charge-related data. Claims data also include diagnostic and procedural codes and more complex methodologies. Clinical information, supplemental claims data, and more complete data improve accuracy of analysis. Basically, the most important thing when it comes to using claims data, you want to ensure all the information is correct. And the way to do that is to always perform quick audits. I tell my students, I don't care if you're an MA, registrar, coder, biller, poster, accounts receivable rep, doesn't matter what you are. If you do a quick audit and all the work that you did for that day to ensure that all your information inputted is right, at least you know that you've done your part right. And to take it a step further, I would actually go into the registration area where schedulers and check-in representatives actually input that information as well to ensure that it matches the insurance card, because that's very important. If the information on the insurance card does not match what's on the claim will be denied, even if the coder coded correctly. So again, this is a team effort. Our job is to get our job is to submit a clean claim from front to finish. Clinical or non-clinical, it is all our job. Clinical can't do their job, so we can't do their job without clinical. So we need to learn to be a cohesive team and work together so we can make sure we get the proper reimbursement that's deserved to us. All right. So next one I have, using demographic characteristics. We kind of already covered a little bit. Age and gender data, elder care, child care, obstetric and gynecology, racial and socioeconomic data, overcome cultural and linguistic barriers, use a service compared to other populations, type of insurance coverage data, increased use of preventative services with managed care, decreased use of ED services with some payers, and high risk factors in Medicaid population. So see, these are some of the key factors that are reviewed and looked over of the demographic characteristics. Remember, we have limited resources. Okay, and this is a major problem that we are facing currently in healthcare. If we continue to wastefully use our resources, there are not going to be any resources left for when the next generation, including my generation and the following generation, there isn't going to be any more resources to treat patients with. So we do all of the things that we do to ensure that there's going to be Medicare 80 years from now plus, there's going to be technology advancements, 80 years plus, that's going to continue to make the human race go forward, God willing. So again, there are so many avenues and factors and areas that are taken in consideration and to determine what is or who is the best candidate to receive these services based off the severity of their illness. Okay, so using disease and procedure-based classification systems. We already covered the MSDRGs and the APC groups, patients by diagnosis and procedures and claim data. Use have patients do not distinguish between different levels of a specific illness. System based on resource consumption, not severity. DRG system includes the use of comorbidities and complications. Consider effects of severity of illness. Either way it goes, in the end, the effects of the severity of the illness, or whoever is the most severely ill patient, is going to receive the treatment first. Okay? For example, if a patient came in and had a gunshot to the bicep area, and a mother was coming in and she was giving birth, and the baby was halfway out of the birth canal, that would be a more serious event that we would have to go ahead and attend to. Okay? So again, there are more than one factors that go into to help determine our final decisions of what we need to do as far as healthcare professionals, whether for clinical or non-clinical. Severity of illness methodologies. Patient data can be grouped and analyzed according to several variations: extent of the disease, risk of death, need of an intervention, urgency of care, intensity of resources, difficulty of treatment, disease staging, and many different systems developed. So again, once you go into the ER, you're going to sit with the triage nurse. The triage nurse is going to assess you, and she's going to determine if you need immediate care or not. If you don't need immediate care, you can go right to the fast track. Fast track is another little department within inside the emergency room. So if you're not has a severe illness or an injury, you will be able to receive your treatment in fast track. ED. Okay, so the case mix index in the DRG system. The CMI index as a measure of resources used for severity of illness. The CMI as a basis for reimbursement influences on a faculty of CMI. Changes made by CMS to DRG relative weights. Changes caused by shift in service. Effects of coding on CMI. Inaccurate coding changes CMI. Incomplete documentation may lead to undercoding. So again, documentation is the key term here for everybody, okay, especially on the physicians. Incomplete documentation may lead to undercoding, so that's why it's very important for your coders, the billing department, HIM department, to have good relationships with your physicians so you can make sure that everything is completed in a timely manner, including signatures, and all the reports are documented appropriately. All right. Well, thank you, students, for listening to Chapter 14, and I will see you shortly with the next chapter. Take care.